My name is Dr. Richard Golden, the inventor of the Physics Forceps. After years of clinical testing and development, as well as listening to our many existing Physics Forceps users, I am proud to introduce to you the next generation of the Physics Forceps, GMX 400 Molar Series. This series consists of two instruments, the EZ1 and the EZ2, designed specifically for upper and lower molars. You can use them on the buccal or the lingual of any molar.
I'm Dr. Tim Kaczynski, and I just want to demonstrate the next generation of Physics Forceps. These are referred to as the 400 Molar Series, and it's very innovative tools. You can see there's two forceps that we work with, the EZ1 and the EZ2. And let's just demonstrate on our model here where we would use this forcep. And if you remember from previous use of the Physics Forceps, we have a bumper and we have a beak, and the beak will engage normally the palatal or lingual surface of the tooth. And if this is our patient's mouth, you would use the instruments traditionally, but again the design is such that it gives us better access to the molar area. So we're engaging the lingual surface of the molar. The bumper is as high up the vestibular low in the lower tooth arch, as low down the vestibule as possible, and we are simply rotating our wrist, rotating our wrist, rotating our wrist, rotating our wrist. Remember, it may take a minute or two, and we will disengage the tooth, and you will use a conventional forceps to remove the tooth from the socket. Now what's unique is we're going to use the same forceps on the opposing arch, the contralateral arch, again engaging the beak on the palatal surface of the cross-arched molar, and rotating our wrist, 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 and then disengaging the tooth, and then using a conventional forceps. But what's unique about the forceps is we could cross use it and put the bumper on the palatal surface of a maxillary molar tooth and rotate the tooth towards the palate. Now in this situation we have a tooth that has a lot of lingual decay or palatal decay, and maybe we can't engage the beak onto that palatal surface. So we would engage the facial surface and rotate towards the palate. Again, it may take a couple minutes, and then disengage the tooth towards the palate. So again, another innovative tool from Golden Dental Solutions, which may save you a lot of time and effort in removing difficult posterior maxillary and mandibular teeth.